The Buzz with Jess Lujan.
Good evening, Guam. I'm Jess Lujan. Welcome to this edition of The Buzz. Exciting show tonight. I have, of course, none other than Senator Dennis Rodriguez Jr. We'll be talking about Public Law 33-143, which was formerly Bill number 277-33 COR, recently signed into law, was passed and signed into law. That basically has to do with the public-private partnership, GMH.
That's right.
First of all, good evening, Senator. How you doing?
Good evening, Hafaday, and thank you very much for having me here.
It's always great to have you on the show. Before we talk about the criticism that you have received regarding this, but you know, most of us already know the genesis of the situation that prompted this bill, and of course the public law. And in essence, again, in a nutshell, and we've talked about this, GMH is a free hospital, is a free institution. We're looking to try to make it work. You formulated a team of experts, basically, mostly composed of private sector individuals, and came together in a short period of time, basically, and these are the recommendations they put together. So, please.
Great. Thank you very much again. So, yes, we have this law now that mandates a request for information, but to back up a little bit, early last year, I put together this task force, as you said, that really the main objective here was to take a look at the hospital, the challenges that we faced over decades, right? And develop a plan of action, a proposal to see how we can move the hospital forward with a long-term solution. None of these Band-Aid fixes that we've been really reacting to. And so that's what we've come up with. And the difference here with this report, Senator, is that we put together a 10-point plan that would guide us in moving forward. And we didn't just look at the hospital. I think in the past efforts, people have just focused in and looked at the hospital and looked at what the immediate needs were at that point in time.
You look at systems of care, right?
That's right.
Yeah,
so we said, okay, we look at the hospital. What is causing this challenge? And we know number one is that you're right. It's a free hospital. People will come in there regardless of their ability to pay, and the hospital has to treat them. So we took a look at that, and one of the biggest factors of that is that people don't have access to health insurance, whether it be public programs, our MIP or Medicaid program, or private insurance. And some of these people are able-bodied individuals that work and are not provided that type of access to health insurance. So part of this 10-point plan is looking at how we can address that, is establishing some sort of universal health care system on Guam. So this thing about the request for information for the hospital, people have been focused in on just that. I just want to make it very clear that it's a holistic approach that we're taking. That's only one component, but if we're going to talk about the request for information for a public-private partnership, we looked at the hospitals, throughout the nation, right? And of course, people say, well, we have a different system here, different setup. Of course, but we looked at the trend of public hospitals and what the challenges are, and we're not unique here in the challenges with other public hospitals. So we kind of took a look at that and looked at how we can improve the system. One of the ways we looked at is is doing this partnership with the private sector. Private sector does things a lot more efficient, and a lot better in some of the aspects. The government must remain in the system to ensure that if it's done by private sector that is doing it right, but to also ensure that our people, even if they don't have the ability to pay, still get that access to care. So that's the kind of balance that we're trying to find.
A couple years back, and it even goes back to I think the 32nd Guam legislature. I know Speaker Wampat, being the I think she presides over the APIL, right?
That's right.
Yeah. And one of the things she proffered out there is some kind of a universal healthcare system, basically
for the region.
Yeah, for the region. Now that in part will if that happens, that will help to take care of some of the problems that contribute to GMH's situation, where there's some kind of health care that wherever they go, in this region or outside of this region, that there's some kind of coverage. Now, we talked about this when I was in your office a couple of weeks back, that, man, even if it's $10, you know, that one contributes, it's $10 less that we have to come up. So, you know, imagine, again, multiplying that $10 times how many people, rather than zero. Anything is better than nothing. But in your holistic look at that, of course, health insurance, part of that, of course, is universal health care for Guam and for the region as well. What are the sources of funding then? We're looking at this because, again, you know, if we go into this, and we're not even talking about the hospital situation as well, it'll be a government subsidy.
Right.
And we already know that the government is not really good in managing, again, something that should be privately managed.
That's right. That's a very good question and a concern, because you know it's going to take resources to do this. But I think first and foremost is a mindset, you know, amongst our community that in healthcare, you know, primary responsibility belongs to ourselves. We must ensure that the mindset is changed. Is that everyone, you need to be responsible, number one, for your health care, but then it has to be a shared responsibility as well. You know, and so we look at now how much we spend on our MIP and our Medicaid, even our GovGuam health insurance for our employees and dependents. We take a look at that, and one of the things we're looking at is perhaps leveraging that amount that we already spend today, and seeing how we can actually distribute that and improve the delivery of health, the health insurance, access to health insurance. So that's one way that we're taking a look at, is perhaps looking at what we're already expending and maximizing that. But we're also looking at other ways to generate revenues to be able to fund this type of system. And I talked about that shared approach. Every time you hear now when the hospital proposes a rate adjustment, you hear primarily those in the insurance industry and the business community really, you know, you really have a big concern. They say, well, it's just going to drive up the cost of health insurance, right? And so right now, our people are already paying for people that don't have insurance. So, and that's the back end, because we know when people go to the hospital, it's when their illness is gone to a point where it's in the worst state of affair.
Because, again, they didn't have primary care.
That's right. Yeah. So the cost to treat that is more expensive. So the whole mindset, the whole approach that we're really pursuing is shifting that, you know, shifting that burden now that our community is already taking on, shifting it on the front end so that people now can get access to primary care. They can go to a doctor if it's a common cold or a flu. Because they have health insurance, they have access to a primary care doctor. Now, without that insurance, they wait till their flu or their cough gets worse. They go to the hospital, and it costs more to treat them there.
No, I'm one of the critics in regards to again rate increases. Okay, and my argument is this: I'm pretty good in paying. You know, and you know, my health insurance and likewise my hospital liability and all that. And I'm saying, you know, the unfortunate thing is it's being taken out on me every time there's a rate increase. And I understand, I mean, I even Frank Campillo and said, you know, I understand when, you know, to bring the price up to where it should be at this point. But it should be all around. And that's what I say. I'm going, I understand we're behind, but why do I have to be the one incurring the cost of being behind? And yet somebody that comes in here and may have an outstanding of $50,000, I have no outstanding, and they said, just well, now your rate's going to go up because it doesn't matter. It matters if you raise me 10% or 500%. The person that's not paying, even if it's 1,000,000% you raise it up, it doesn't matter.
That's right.
So again, you're right. People are frustrated with that, and again, it's not inequity with everybody.
Yeah, and Senator, you know, one of the things here is that you're right, and when the argument is framed that way, you're absolutely right. You know, because it's being placed upon those that have insurance and that actually pay. The problem I have here is that our government, the hospital has been politicized for far too long, and so 20 years ago, when we should have adjusted the rates for a supply that perhaps cost us 5 cents at that time to buy. We didn't, because we said We can't do that to our people, right? Without really having that rationale behind it. So now you're forced to have to make those adjustments based on the time that you didn't adjust it. And so that's a very difficult,
It is.
it's a
It is.
very difficult
Yeah,
argument
yeah.
to make. But and that's where this public-private and perhaps taking away the operations from politicians, like us that control these things, then maybe things can really improve. Because rate increases, I'll tell you, I don't like it. It's not popular. But in this case, when you buy something for, when you're paying for something for less than what you're charging, it doesn't make sense.
Anyway, we're going to take a quick break. We'll
Sure.
come back and talk more about public-private
Okay.
partnership. Be right back.
Thank you.